Hi everyone, I'm Pat.gillham. I am the director at Driving Performance Golf, which is a golf-specific physiotherapy clinic here at the World Golf Driving Range in New Malden, Surrey. I'm going to talk to you about swing positions that might contribute to injury. And the first injury we see is just very commonly is the lower back. Now the three common swing patterns that I usually see with amateurs that might contribute to lower back firstly, as we're looking down the line, at impact. So when we hit the ball, we get a big closing pattern on one side and a big stretch pattern on the other. So this is at impact. We get a big compression on one side and stretch on the other. And if we think about the forces of the golf swing, obviously these tissues on the right hand side are not going to particularly tolerate that sort of compression force, and exactly the same on that left hand side. This stretch force is going to irritate these structures of the lower back. So that's number one. Number two is an excessive arching through the lower back at address, which then golfers maintain as they come into their backswing and as they come into their impact and follow through. So that's number two, is that excessive arching. And number three is where golfers get a little bit too steep either on the backswing or the downswing, and as a result we get a very large arching in the backswing, which again causes a big stretching on the trail side, and then as we come down we again get a large stretch and compression on the opposite side on that downswing too. So they're the three most common. Now, disclaimer is that I'm not a swing coach. I'm not a golf coach at all. I'm a physio. So it's really important from a skill point of view and a technique point of view that you are collaborating with your swing coach and the physio. So my role as a physio is to look at how we can get the golfer rotating better. We can do that in two ways. So if we get the golfer rotating better either through their spine, their hips or their shoulders, then it gives them a lot more room to rotate, and as a result we can prevent these side bending, compressing and overstretched positions. And realistically I would look at how someone is flexible into that rotation, and also whether they're strong enough to create those rotational forces either into the floor or with their spine and their trunk muscles. So they're really simple ways to resolve that issue in their lower back. But if you have any questions, you want to speak to me about these injuries, then feel free. My details are in the notes below, and please contact me directly. It's very common and it's very resolvable.